Hello, welcome to this NMC OSCE clinical skills video. My name is Hannah. I am a UK registered nurse of 20 years and a UK university lecturer, and have also been an OSCE training lead. And I'm sharing with you some information and tips to help you practice at home and study for your NMC OSCE exam. When I started doing OSCE lead training, there was lots of really poor quality and inaccurate videos on the internet, so I wanted to try and change that. And these are for you to help you study at home. You can pause along as you go and practice, and to give you a bit of insight into what is involved and required in the stations. So today we're going to look at administration of a suppository. Okay, so administration of a suppository, one of the adult clinical skills for the NMC OSCE. It is a 10-minute station. Okay, and there's quite a lot to remember and verbalise in this station around post-procedure advice for the patient, which often gets missed and is a critical fail. So for the station, you need to explain and prepare the patient ready for the suppository. You need to read and confirm your prescription. You need to correctly administer the suppository. You need to document the administration of suppository on your medication chart. You need to give the patient post-procedure information, and you must at all times ensure privacy and dignity with this procedure. So what equipment will you get? So you'll get the mannequin bottom here, just the rectum area, and an incontinence pad. And it's really important to remember with these clinical skills stations, when you've just got part of a mannequin, that you are talking to the patient and pretending that you have got a real patient there, and ensuring privacy and dignity. So making sure you replace any bed covers or a towel, and sometimes that can be forgotten because you've just got part of a bit of a mannequin. Okay, you will also have your suppository medication. Okay, so this comes in the white medication tablet packets here. Okay, you open them up from the top. They have an expiry date on the back. Okay, normally it is glycerin suppositories of 4 grams. Sometimes the test centres will put the depositories into. Sometimes the test centre will put the suppositories into a medication bottle, similar to what you have in your implementation station. Okay, so they will have written on the bottle there the suppositories, the dose and the expiry date. You need some gauze, okay, and you also need some lubricating jelly. And again, some test centres don't have lubricating jelly. They have a little pot of water, and you use that to lubricate your suppository. So just be aware of that. So that's your key bits of equipment. You will also need PPE for this station, so apron and gloves. So what paperwork and documentation will you have? So you'll have your scenario and you'll have a medication administration record, okay? So your scenario might be something very brief. So for example, Jane's not had her bowels open for 5 days following surgery. Please administer the suppositories as prescribed. You'll have 10 minutes to complete the station, and you must complete all the required documentation as well. And then you'll have your prescription chart. Now, this might come in various forms. You might have it like a once-only medication prescription chart like this. You might have it as a regular medication. So if you think back to your implementation station and how the regular medications are prescribed, you might have a community prescription, okay, so community-specific directive as well, or you might have a single sheet prescription as well. Doesn't matter what prescription chart you have, you must identify those key areas from the chart and read that out, and we'll go through that. So I like to break my stations down into small separate stages, okay, so we've got that mental mind map of how we're going to go about this station. It also breaks the station down in terms of when you're learning it, so it doesn't feel as overwhelming, okay. And I also teach the clinical skills how I would naturally go about doing this procedure in practice, okay, which sometimes is a little bit different to the order of the marking criteria. Now that is okay as long as you are not doing anything unsafe. So for me, I would always introduce myself, explain the procedure and gain consent before I went off and checked my equipment. Okay, that just naturally makes more sense to me. So that's the type of approach I teach, okay, but it's important that you do it in a way that feels comfortable for you and that you can remember, okay? And some patient safety critical aspects you have to do in the correct order. So I have to read my prescription chart I have to do all my ID checks. I have to do all those key points before I administer the medication, okay? But I always start with my key principles. So, that is my safety, privacy, introducing myself, checking my patient's ID. So this is really important because you are giving a medication in this station. So my ID checks and my allergy checks, verbally against the wristband and the documentation. I'm going to explain this procedure, okay, so make sure you are explaining the procedure that you are going to insert a soft pellet into the rectum, into the bottom of your patient, and it is a little bit uncomfortable. Be honest about that, okay, and then get consent. Then I'm going to go on and read my prescription, okay, because again, if I haven't got a clear, valid prescription, I'm not going to be able to go and get my equipment out, okay, so that's a logical way that I would do that. So I'm going to read the prescription, confirming it's clear, valid and legible. I'm then going to go and get my equipment and check my equipment and my medication and check my medication against my prescription. I'm then going to position the patient, okay, and I think I would do this then rather than right at the very beginning, which it has in the marking criteria, because I would think that would be uncomfortable to leave the patient on their side and near the edge of the bed whilst I go and read my prescription and get my equipment. So that's why I would position my patient when I came back. I'm then going to put on my PPE and administer my suppository. I'm then going to give all the post-procedure advice to the patient. I'm going to dispose of all my waste, decontaminate my hands, do my documentation, and then check my patient is comfortable and end my station professionally. Okay, so starting off with point number 1 then, starting your station and key principles. So like I said, quickly, safety, privacy and dignity is really important in the station, okay? So making sure I close the doors and shut the curtains. I'm going to decontaminate my hands using that 7-step World Health Organization approach. I'm going to introduce myself with, hello, my name is Hannah. I am going to confirm ID, so name, date of birth and hospital number, or name, date of birth and address if you're in the community. I'm going to ask them to confirm that verbally against the wristband and the medication record, okay? Then I'm going to check my allergies, okay, and what reaction they have, and check and verbalise if they have a red wristband and that matches my medication chart as well, okay? So really important step in the station. Then I'm going to explain the procedure and gain consent and check my patient is comfortable and not in any pain before I proceed, okay? Then I'm going to read my prescription. So it doesn't matter what type of prescription chart I have, I'm going to read the full prescription. So the date, the drug name, the dose, the route, the time, the prescriber's name, signature and date, okay? I'm going to confirm that that prescription is clear, valid and legible, okay? And I'm going to make sure all my patient details, my name, date of birth, hospital number and allergies all match that prescription record, okay? So reading that prescription is absolutely crucial in order to pass this station. And you read it exactly the same as you read out your prescriptions in your implementation station, okay? And I'm going to go and get my equipment, okay? So for this procedure, I'm going to need a bedpan or commode. So I'm going to verbalise, I'm going to get that. I'm going to get the incontinence pad, so the blue and white pad that goes under the patient. I'm going to get my PPE, so my gloves and my apron. I'm going to get my suppository medication, and when I get that out of the trolley, I'm going to check that against the prescription chart to confirm I have the right medication, so the name, the dose, okay, the expiry date, and I'm going to verbalise how many suppositories I'm giving, okay? So if I've been prescribed 4 milligrams and my suppositories are in 4 milligrams, I'm giving 1 suppository, okay? I need to get some gauze and I need to get some lubricating jelly, or sometimes it's just a little pot of water at the test centre. So I've gathered all my equipment. I'm coming back to the patient, so I'm decontaminating my hands and I'm going to put on my PPE, my apron and my gloves. Now I'm going to assist the patient and verbalise, assisting them into the correct position, because I think this is the right time to do this in terms of patient comfort. So I'm going to verbalise, I'm going to ask the person to lie on their left-hand side, their knees slightly flexed and their feet level or slightly raised, and their buttocks near the edge of the bed. I'm going to place the incontinence pad under the patient, okay? So remember, you'll just have that part of the mannequin, okay? So you just remember that you wouldn't move like the whole mannequin, you just, the buttocks would be, you'd put them into that position, okay? And then I need to assess the patient's anal area, okay? So observing for evidence of skin soreness, excoriation, swelling, hemorrhoids, and rectal prolapse. And that is a really key part of this station, and that you verbalise that. So now my patient is all ready. So I'm going to put some lubricating jelly on my gauze square, and I'm going to lubricate the suppository. I'm going to separate the patient's buttocks and insert the suppository, advancing it 2 to 4 centimetres. And I'm going to verbalise that I'm doing this all the time to the patient, so it's not a surprise to them, okay? If I have more than one suppository prescribed, I'm going to do that procedure again, okay? And then I'm going to get my other piece of gauze and I'm going to clean the excess jelly from the patient's perineal area. This is a really important area to do and not forget, because if you leave the jelly, the moisture can cause skin damage, and that could be a critical fail in the terms of your NMC exam. And then really always make sure you replace the bed covers or put the towel back over the mannequin. Once I've administered my suppository, I'm going to verbalise to the patient kind of post-procedure advice. So this is really crucial as well, that you remember to do this. So I'm going to advise my patient to remain lying down and to retain the suppository for 20 minutes or as long as they can. I'm going to inform them that they may experience some liquid discharge as the medication melts in the rectum. Again, another important part to remember. And I'm going to verbalise that I would assist the patient into a comfortable position and assist them into the bedpan, commode, toilet when needed, okay? And I might phrase that to the patient, such as, you know, as soon as you feel the need to go to the toilet, press your call bell and I'm going to come and assist you into a comfortable position onto the bedpan, commode or toilet, whichever you prefer, okay? So that post-procedure advice is absolutely crucial for passing this station. Then I'm going to dispose of all my waste, okay? So I'm going to put all my waste into the orange clinical waste bin. I'm going to remove my gloves and then my apron in that order, and I'm going to decontaminate my hands using the World Health Organization 7 steps. And then I need to come to my documentation, okay? So again, it's absolutely vital you complete this in order to pass your station, okay? So I'm going to sign and complete the medication chart. And again, you just need to be really careful you're completing all parts required. So signature, date and time, okay? If you have a full hospital chart, like you'd have in your implementation station, you need to sign that front page as well, which has your name, initials, signature and base, okay? So whatever prescription chart you have, just make sure you are completing all the required information, okay? Signature and date, signature date and time. And then I'm just going to finish my station. So I'm going to check the patient is comfortable, that they do not need anything, okay? I'm going to ensure they have the call bell if they're in the hospital and they know how to press it when they need assistance, go to the toilet. I'm going to do my final decontamination of my hands, and I'm going to, if I have any time left, double check my documentation, okay? Okay, so my top tips for this station is don't forget your ID checks and allergy checks. This is a medication administration station, it's absolutely essential. Read the full prescription, including the date, time, drug, dose, route, prescriber's name and signature. Confirm that it is clear, valid and legible. Verbalising, positioning the patient onto the left-hand side at the beginning, and that post-procedure advice, okay? Ensure your privacy and dignity throughout, okay? And document on the medication record. Make sure you do this correctly and complete all parts, date, signature and time. Hope you found this video helpful. Please like and subscribe. So I'm going to be putting up lots more clinical skills videos over the next month or so. Again, use these to practice at home. Okay, you can pause them. You can do your skills alongside with them. Okay, I'm also available for one-to-one tutoring. So to go through your skills with you, give you one-to-one feedback, you get access to all my teaching resources. So that's full API scenarios, care plans, professional values. I've also got more detailed and exact clinical skills videos performing the skills. Can also offer you just mock OSCEs as well. And I can do those online as well as face-to-face. You can email me on hannah.l.ames@outlook.com or visit my Facebook page as well, Nurse Tutor, Tutoring with Hannah.